Diana, what are some things that are actually accelerating in the economy as a result of COVID?
Well, we've seen COVID act as this, dramatic accelerant in things like in the hospital sector and in the healthcare industry. We're seeing that accelerant of the disparities between rural and urban areas accelerate, inequality accelerate. And this is really important because as it is, rural areas are starting to get hit very hard by COVID, and it's much harder to reach some of these hospitals. If you're in a rural area, they're much more underserved. We know that there are great disparities in the kind of healthcare that people get that are insured versus non-insured that have accelerated. So it really has so many dimensions on how many inequalities this is accelerating. And then this gets to the issues of, what does that mean for our long-term health of our labor force as well? As these pressures accelerate, we worry about how consolidation in the healthcare sector, consolidation in the broader economy undermines dynamism, but in the healthcare sector in particular, it can literally take a toll on our physical health and our access to quality healthcare across the board. Here we have an enormously great healthcare system in the United States, but it's very unevenly distributed, and COVID has really accelerated those trends and accelerated the disparity between rural and urban America, the racial divide and the income divide, and that is showing up in the healthcare that is being distributed as well. One other note that's important to remember about COVID is not just its effects and its risk of morbidity, its risk of people perishing from it, but the long-term effects of COVID and what that might mean to costs on our healthcare system going forward, and what it means to people in terms of absences and their labor market going forward. Even young people and those with more mild cases are having long-term effects of the disease that could really dramatically compromise their health and their participation in the labor force for some time to come.
And David, I'm going to turn it over to you now. And what about accelerants in healthcare? What are you seeing as well?
Obviously, we've seen a tremendous shift to telehealth out of necessity.
Yeah.
There will be some subset of that that's retained, but we're never going to have a surrogate for an in-person physician office visit for the preponderance of what we do. So the sooner we see that begin to recover, and that's really a leading indicator for us on what's going to happen for the balance of the system. So if we see people returning to the doctor for necessary procedures, for necessary diagnostic testing, that's going to be really important for us. We do think that hospitals, by and large, are focusing on controlling costs, but we do see a little bit of light at the end of the tunnel for those high-performing hospitals and health systems, and beginning to return to a little bit more business as usual. We are seeing those people that can invest have a great opportunity to invest to accelerate their recovery. Not necessarily accelerate any clinical trends relative to COVID or even any societal trends relative to COVID, but they're looking to do the things that they've postponed. There have been a lot of large, significant investments that healthcare enterprises have not made over the last 8-9 months. If that continues for 15 months, that's very different than if it continues for 10. So we think that economic recovery will be great for hospitals that have the ability to do it. They'll be able to rebound from COVID a lot more quickly than some of their competitors will be able to do. And we are in the process right now of working with our clients to determine what types of those investments, whether they be additional staff, new equipment, hiring of additional physicians, or opening of additional service lines that we think are going to be really important. One of the less told stories around COVID from a clinical and a business perspective is the lack of diagnostic testing that's happened over the last 9 months. We think that bolus of activity will result in some really detrimental health trends. If you haven't gotten diagnosed with cancer because you haven't been able to get the lab work, or you have chosen not to go get the lab work, if you have not been getting treatment for an early diagnosis of cardiac disease, that's a real problem. And it's an economic problem for hospitals, but perhaps even more importantly, it's a real problem for all of us. If we and our loved ones aren't doing the things we need to do to maintain our health outside of COVID, heart disease didn't stop because of COVID, and neither did cancer. And so I think one of the things that we really need to see is our hospitals investing even before they might be truly prepared or truly ready, so that the recovery can be accelerated across the board for all their industry.
Diane, David, I appreciate your time today and your insights, so thank you.